My case study was on metastatic melanoma. I have a anatomy of the brain because that's what we're going to be focusing on, because my patient had metastasis to the brain. As you can see, the brain consists of the frontal lobe, the parietal lobe, occipital lobe, and temporal lobe. But my patient's metastasis was in this frontal lobe. And it's just another image of the brain. You see your cerebellum in the back, posterior portion. You have your cortex at the top. The outer portion of the skull is just the cranium, spinal cord, and brain stem. This is just another image of how melanoma works, because it's cancer of the skin. It starts in the melanocyte, and then it starts to spread to the basal cell. And as you can see over here, you have the top of the skin, which is the epidermis, the middle portion, which is the dermis, and the subcutaneous tissue, which is at the bottom. So histology and pathology of melanoma is squamous cell carcinoma and the melanocytes. Metastasis, they can spread through the lymphatic system, blood vessels. Melanoma can spread via subcutaneous tissue, which lies underneath the skin, lymph nodes, and other organs such as bones, livers, lungs, or the brain. So this is my case study. This was a 45-year-old white Caucasian male. This patient had metastatic melanoma that started in his third digit. The patient had a biopsy that confirmed that diagnosis with ulceration. He underwent multiple resections of the third digit, and eventually it led to amputation. He had a CT of his chest, which showed enlargement of his right chest wall, lymph node, and new right lateral chest wall nodules. Lastly, he had a MRI of his brain that demonstrated 2 intracranial lesions consistent with disease progression. So we're going to be focusing on the brain portion. The risk factors for melanoma is UV or exposure to UV or ultraviolet light, having moles, fair skin, freckles, or light hair, family history of melanoma, other skin cancers, a weakened immune system, age, just being a male, and xeroderma pigmentosum, which is a rare inherited skin condition that affects the skin. Well, it kind of cut off a little bit, but it affects the skin's ability to repair its own damaged cells. This patient had no presenting symptoms that was documented. He also didn't have any medical or social history that was documented. His diagnostic workup consists of a PET scan, CT, and a brain MRI. Confirmed pathological diagnosis was primary C7 9.9, secondary malignant neoplasm of unspecified site, but we know that it was spread to his brain. His stage was stage 4, TNM1. His treatment, he had an SRS frameless. It was palliative, VMAT, 27 gray total, 9 gray per fraction, 3 fractions, and no bolus. The patient didn't have any brachytherapy or a boost. The patient setup was a frameless mask, a Orphid base plate with custom cushion, 20 millimeter block, headrest G, red, pad abutting headrest, red knee wedge, arms down and strap, and the patient was supine. This is just an image of the patient's prescription and treatment plan. This also shows the organs that were at risk. His right optic nerve and left optic nerve, also his brainstem, spinal cord, right and left orbit, right and left lens, right and left optic nerve, as I said before, the optic chism, and the right and left cochlea. And his treatment plan report. And he has, let's see, 1, 2, 3 fields. He had 3 fields. And this is a picture of his DDH. And also his anatomical pictures. His side effects were not documented as well, and neither was his follow-up. The 5-year prognosis was, the 5-year survival rate was 92%, and it also depends on the thickness of the melanoma. And here's a chart that can better depict that. So earlier detection, you have a better chance of survival, but the later the detection, the size of it, and metastasis decreases your rate or your chances of survival. And here are my references.